Having reviewed the relative merits of long-acting and oral antipsychotics, let's check back in with our 3 cases. So let's think back about James, who had a mother who was very worried about another episode, who had been rehospitalized, likely to not having taken the medication as prescribed, was beaten up by strangers because he was acting most likely strangely, and who may not be taking medication as he should, plus maybe weighed down by the interaction problems with the mother who belittles him by always checking on him. Would this patient not be able to benefit potentially from a long-acting treatment, taking away the conflict at home, assuring treatment, but also with his prolactin increase, having maybe less peak-trough variation so that the prolactin levels would decrease also? Let's now think about Joanna. What were her problems? She was on medication that gave her side effects, weight gain, metabolic abnormalities that are in the borderline range, but also feeling sedation and complaining that the side effects interfered with her daily routines. She is seriously questioning whether she should even take the medication, feeling fine. What we often see then is patients stop the medication and feel shortly better because the immediate effect of the medication is gone and they don't get a relapse right away. So they're lulled into the safe security that they can stop. Talking about a long-acting injectable can help the patient restabilize who was just getting more easily agitated and preoccupied, who may run into trouble with other patients in the group home or even potentially lose the ability to live there or have to be rehospitalized. So talking to her about the long-acting treatment option, finding a medication where she may not be as impaired by the side effects, and then linking the stability to the medication she's taking as a long-acting formulation could help resettle the treatment plan into an area where she can remain stable and have an improvement in her functioning and quality of life. Now let's think back about Tom. Tom is young, he's 21 years old, he's in college, and he had this psychotic episode that really unhinged him, but he's back on track. He responded well, like many first episode patients do. He's on a medication he can tolerate reasonably well, and he's really worried that he will have a relapse. What can assure being relapse-free for the longest time? It is a long-acting treatment. And it's also a long-acting treatment where in a dorm environment, he will not be seen taking medications, where the self-stigma and potential discrimination will not add to the stress that he wants to avoid further psychosis. Also, as we all know, in college environments, there is some marijuana or other drug taking. And in that environment, often the medication is not taken at the same time, bringing the risk for psychosis even higher. So here again, having the backbone and the seatbelt that we can give Tom to have a stability in the college environment, putting his mind to his studies rather than having to remember taking the medication, would be a best start on the road to recovery and also success.